Hello, I'm Robin Koval, the CEO and President of Truth Initiative, and it is my pleasure to welcome both our in-person and our virtual audience to today's Truth Initiative Impact Series with Dr. Brian King, Director of FDA's Center for Tobacco Products. As many of you know, Dr. King has a long history as a scientist working on the tobacco issue. It's more than 20 years of experience, including a long tenure at CDC, where he was most recently the Deputy Director for Research Translation in the Office of Smoking and Health. Brian holds a PhD and MPH in epidemiology from the State University of New York in Buffalo. And of course, in July of this year, Brian joined FDA as a director for their Center for Tobacco Products, where he's charged with leading the vision and the mission of the center's implementation of the Family Smoking Prevention and Tobacco Control Act. Before we get started, I just want to let everyone in the audience know there will be an opportunity for questions at the end. For those of you who are attending in person, you have some cards and pens on your seats. Please use those and write your questions on the index cards, and we'll collect them throughout the session. For those of you participating in the live stream, you can enter your questions through the Q&A function. Please, for everyone, include your name, your organization, and we'll do our best to get through as many as possible. So now, with that bit of housekeeping out of the way, I'm delighted to welcome Dr. Brian King. Hello, Brian, and thank you so much for being here with us today.
Great. Thanks for having me.
Welcome, welcome. So, all right, so let's get started. You've been at FDA now for, I guess it's about 4 months.
Correct.
How's it going?
It's going good. People know I've been publicly saying baptism by blowtorch, and I absolutely mean it. But nothing I didn't expect. I certainly knew what I was getting into when I came into the position, and as you know, I'm a very well-seasoned civil servant. So folks can sleep very well at night knowing that, or maybe stay up late at night cogitating over that fact. But I've been able to hit the ground sprinting, and I think it's a good thing on multiple fronts.
Excellent. Any surprises, unexpected rewards, or?
Well, I think my biggest plus is that the team is excellent at FDA. We've got 1,200 dedicated civil servants who work day in, day out to achieve the mission of the agency. And of course, I've worked at the CDC before this, but I'm really hopeful that moving forward, we've got a great team and a lot of excitement and wherewithal to keep things moving in the right direction.
Well, that's important, walking into a team that's ready to hit the ground running with you. I thought maybe we'd start a little bit on just sort of your perspective on, kind of where we've been and over the last few years, and, your thoughts on just sort of the overview of the tobacco product landscape, which has changed so much over the past few years, the rate of change, the amount of products, which has certainly made the job, I think, much more complex, and just maybe, your thoughts on how this very, very changed environment is impacting your work.
Yeah, certainly. So I think that there's some misperceptions out there in terms of the battle against tobacco-related disease and death being won. And we certainly have a far way to go. When you look at the stats, we still have nearly 500,000 Americans that are dying each year from smoking-related diseases. And for every one that's dying, you've got 30 more living with smoking-attributable diseases. And so there's certainly that considerable burden health-wise on society, particularly for combustible products, which we know comprise the greatest burden of death and disease. And it's not just the health aspect, it's also the money. And if you look at the latest stats that were released by CDC, we're looking at $600 billion a year. So literally $1 million a minute are being spent in this country to address not only direct healthcare costs, but also lost productivity from people who have died and have otherwise not been able to contribute to society because of smoking-attributable disease. So I do think we still have a far way to go, not only in terms of absolute prevalence, balance of reducing tobacco product use, but also ensuring that we're addressing some key health disparities, which I'm sure we'll get into later. But I think it's important to note that we've still got a hard road ahead of us. And I do think that it's complicated by a variety of factors, and that includes the diversification of the landscape. And particularly when it comes to kids, what I feel very strongly about is that we don't want to be playing that game of public health whack-a-mole,
right,
where we allow certain products to go down and others to go up. And it needs to be a concerted effort that we're mindful of the diversity of the products and make sure that it's a part of everything we do, whether it be our science, our public health communications, and importantly, our policies as well.
Yeah, I mean, it is. You make a good point that we often just don't focus on the magnitude of the problem that still exists, and sort of get down in the minutia. But thinking about it from that big picture is really important. And I guess that kind of leads me to the second question. And you even mentioned health equity as one of your priorities. You have talked a little bit already about your goals coming into CTP, and I thought, nice to just remind us of those, and also maybe how you came to those. Like, I'm sure there were a million things on your plate, and everybody was, we need to do this, we need to do that. How you sort of sorted through to get to the big picture.
Yeah, so absolutely. So there's 4 underlying pillars or themes that are driving me. A lot of times when I come and do talks and early on, people are asking, what are your priority areas? And of course, I have programmatic priorities. But I think it's important to take a step back and really look at what are those factors that are influencing my decision making. The first and foremost is sound science. And obviously, I'm a scientist by training, and that's new to the picture. I'm the 3rd CTP director. We've had a clinician, a lawyer, and now a scientist. So there's a funny joke in there about the 3 of us walking into a bar somewhere. But I think that perspective is important because everything we do at the agency is founded on science. And looking at that lens is really important. And so for my part, I'm committed to taking a very critical eye to the work we do and making sure that we're using the strongest possible science to inform our decision making. And what I don't want us to do is settle for just the best science we've got, because that doesn't necessarily mean that it's the best science to inform the actions that we're taking. And so for my part, science is front and center. The second is partnerships and stakeholder engagement. This has been the foundation of my career for the 20 years I've been in tobacco control, is bringing people to the table and discussing. And you may not always agree with people, but that doesn't mean that you can't have civilized discourse about the facts, about the information to make an informed decision. I'm not Pollyanna in terms of everyone's always going to agree. It's not a reality. It's not going to happen. But I do think it's important that we do bring people to the table in a way that they'll be able to engage in meaningful dialogue. And towards that end, this year alone, the Center for Tobacco Products has done 25 meetings with stakeholders, and 20 of them have been since I arrived. And I think it's important that we engage with folks early on and keep that engagement going on and look for more opportunities. The third is communications. This has also been a crux of my career. In CDC, I was tasked with being the Deputy Director for Research Translation, and that's take the science, package it in a way that people are actually going to understand. And that's easier said than done. And I say that as a self-respecting scientist, that it can be tricky. But I think it's important for us to be mindful of what is the focus of the content we're relaying, who are we relaying it to, and how are we relaying it, and when are we relaying it. And I think that's an important component of not only the science, but also in terms of regulations and the messaging we issue. And then the final one is health equity, which we've touched on. I've said it before, I think we have been wholly deficient on this issue as a broader community for many years. And I think that we're at the precipice of a very critical period, particularly around some of the product standards that FDA is proposing, to really step up to the plate and address some of these long-standing disparities that we've seen related to tobacco use more broadly among both adults and youth. And so for my part, on the health equity component, we've already taken some key steps at FDA to ensure that this work is front and center. As some folks are aware, we've announced the hiring of a senior advisor for health equity. And that person's first role, once they get in, is going to be to develop a strategic plan for us to ensure that health equity is a component of all we do, our science, our health comms, our regulations. And that's not to say we haven't done work already. We've made meaningful steps. We recently discontinued use of grandfather terminology in our work, and also included some important health equity language in some of the product standard language. But I do think there's definitely more to come, and I'm really hopeful for the future on that front.
Well, I want to get back because the fact that you are a scientist and that you are prioritizing the importance of that. Do you think the ability to focus on what is good science, how the agency works in a way that's always driven by science, has that gotten harder over the years? As we all hear about the war on science, and it's not just about FDA. I mean, it's something I think that we deal with in many aspects in everyone's work.
I think it's a very important issue that's certainly come front and center. Folks know that between my roles at CDC and tobacco and FDA, I was the chief science officer of CDC's COVID-19 response. So I've certainly addressed this issue from not only communicable disease, but also non-communicable disease. And it's an important issue in the field. And I think that we have to be very mindful of the important role that science serves in our decision making and ensuring that we do stick to the facts and we do have constructive dialogue about the facts, but not in a way that's leading to misinformation. And that there's certainly rampant opportunity for that, particularly with increases in social media dialogue. But for my role at FDA and my previous role, it's making sure that we do stick to the science and it drives all our decision making. And I can assure folks that that will certainly be happening during my tenure at the Center for Tobacco Products. Under my leadership, I would not allow the science to take a second fiddle to any decision making, and it's going to continue to be at the forefront. And I will note that there's always going to be political presence, and I've worked across 3 administrations. That's how the government works. You have political appointees, but that doesn't mean that the politics is influencing the science of the decision making. And for the career civil servants like myself as a center director, our role is to ensure that we keep that steady hand. We maintain the integrity of the science and the work we do, so that we do have that objectivity regardless of what the administration may be.
I think that's very heartening to everyone here because, of course, from Truth Initiative's perspective, we always say everything we do is grounded in the science. So we are kindred spirits on that. Getting to some of the issues, and we're talking about health equity, and of course, you can't think about that without the, we hope, soon to be enacted rule on menthol. And I know, the comment period is closed. You are all, of course, deep in the evaluation of all of that, I am sure. But, what can you share about sort of where the process is and how the process will go forward? And I think maybe even for those in our audience, how we can still be helpful as you go through that process in hoping to, of course, I'll speak for Truth Initiative. We would love to see that rule out, enacted, in place as soon as possible because it is so important. And of course, I was talking about menthol, but of course the cigar flavor rule as well.
Yeah, no, I definitely appreciate the interest in this. And as someone who's been in the field for many years, I understand the profound public health impact that this rule can have. And there's strong science demonstrating the adverse effects of menthol and also, importantly, the health equity implications. And I think, of course, we have very prominent disparities for the African-American population, but menthol disparities extend across a variety of populations. LGBTQ+ is a good example on behavioral health condition populations and also those with lower socioeconomic status. So I think we really have a profound opportunity to make an important difference, both for that and also the flavored cigar rule. That said, it's front and center in terms of priority for me. And of course, with any self-respecting government bureaucracy, things take time. There's a process that has to occur in terms of proposing the rule, soliciting comments, and then finalizing that rule, and then a couple more comments after that. And then normally the effective date is about a year after the final rule is issued. So right now we're finished with the proposed rule, and we completed the comment period this summer. We got about 250,000 comments. Not any negligible amount, and FDA goes through every single comment. I did get a readout of every single comment. I have seen the summary, and some more nuanced than other, but that's the good part of the procedures that we follow, is that everyone has a role, and they can participate in the process. And so in terms of next steps, we're committed to getting through those comments as quickly as possible, and the next steps, based on those comments, could be multiple things, but it could be a finalization of the rule or for revision of the rule or even rescinding of the rule, but I can assure you that we're committed to moving as expeditiously as possible to make that happen. In terms of your question around what others can do, I think it's important that we put the pedal to the metal in terms of preparing for a potential rule, and that involves a lot of key components, but I think a critical one is cessation resources. And we, of course, know based on the science that this proposed rule would work regardless. We know it's going to have a net benefit, but that doesn't mean that we can't capitalize on the opportunity to enhance access to barrier-free access to cessation resources. And towards that end, I think it's a really pivotal opportunity for us to think strategically about how we can ramp up access to the proven methods that we know work, and importantly, getting them into the hands of people who can use them in an equitable way. And so that's really my charge for the broader public health community, is making sure that we are prepared for that opportunity. And I also think there's some very critical discussions around criminal justice and social justice issues. And FDA has been very clear that there will not be an individual level enforcement provision. And so an individual would not be held accountable for individual use of menthol or possession of a menthol cigarette. But it's important to consider the potential social justice implications, particularly at the state and local level. And it's important that we educate people ahead of that. We galvanize key stakeholders to make sure that we avoid any misperceptions or unintended consequences if a potential rule were to move forward, to ensure that we're maximizing impact and really focusing on the true benefits of what we could really achieve through the implementation of such a rule.
So can you talk a little bit about, this preparation process, which I couldn't agree with you more, and there couldn't be a better time to be encouraging people right now to, if you haven't tried to quit. There's help out there, how to access it. Can you talk a little bit maybe about how you're even coordinating within the government? Because, of course, FDA will promulgate the rule, but there's a lot of other government activity that can take place to help that rule go forward and to help the people who are impacted by it.
Yeah, so you're absolutely right. And for our part, FDA is part of the U.S. Department of Health and Human Services. I always remind people that our purview is health, and our vision involves reducing tobacco-related disease and death. So we're in good company with other health-related organizations, including CDC, Center for Medicaid and Medicare, Indian Health Service, National Institute of Drug Abuse, and others. And they really serve a critical role in this as well. And so for our part, we are coordinating across agencies within the U.S. Department of Health and Human Services, and it is a priority to maximize the available resources. NIH, and specifically the National Cancer Institute, has a strong background in cessation resources. 1-800-QUIT-NOW through the CDC, state tobacco control programs, and various others have really key levers that are going to be important for us to leverage in a comprehensive way. And so for our part, we are actively coordinating across agencies, identifying synergies, and also looking for new stakeholders that we can bring to the table. And that said, it also involves engagement with other departments. Department of Justice is a good example, where we want to make sure that we have our bases covered in anticipation of a potential finalization of the proposed rule, and we want to be prepared. So again, we can maximize the effect as opposed to being distracted by other factors that aren't going to help us get to that end goal.
Might those be the lawsuits that will...
Another day, another lawsuit, yeah. And notoriously, everything FDA does, we get sued. That's par for the course. But I'm very hopeful. And to your point earlier around the science, if the science is strong, that's our strongest defense. And so there's been several wins for FDA recently, legally, important wins upholding the processes that we follow. And I'm committed to making sure we continue to use those rigorous procedures. It's inevitable. There will always be lawsuits, but I'm hopeful that we're going to stay the course, focus on the most important priorities, and keep the train moving.
So one more question about, how we can all help you and your efforts to get this rule forward. We have a lot of young people in our audience. Of course, at Truth Initiative, we're always focused on young people, and the menthol issue is an important one for young people, I think, as, one of the populations that has been impacted. What can we do? What should they be doing? What can they be doing? What advice would you have for our young folks in the audience?
Yeah, so I think it's kind of threefold for the population in total, but particularly for youth, I think galvanizing around this issue in a meaningful way and leveraging the opportunity to educate, to promote key messages, to quell misperceptions around the rules and also the products. And I can't reinforce enough the importance of communication and locally salient delivery methods, and being mindful of who's delivering the message. How are we delivering the message? Is it using a platform where we can reach those key populations around youth and young adults? And so for me, we have a lot of great resources. FDA in particular has a lot of good resources. And so ensuring that we leverage those in addition from those from non-government organizations and really getting them in the hands of people that can galvanize the base, relay the science in a way people can understand and meaningfully contribute to the dialogue. But it doesn't end there. I think that it's also important call to action to the scientific community. And we have enough science to act. But that doesn't mean that we can't continue to grow in terms of the available evidence base and also continue to innovate. And that said, the scientific research community plays a really important role, not only for public comment periods. I always encourage people, we need you to submit the information. People will send me an email and say, oh, have you seen this study? And I say, please submit it during the comments so we can consider it. But in addition to that, it's important that we continue to also see the science grow. And then finally, I do think people can also play a role in terms of making sure that we're mindful in the clinical space around enhancing opportunities, not only screen for tobacco product use and have those discussions with patients and others, but also get them evidence-based treatment to make sure that they have the resources to quit. And also engage and follow up, whether that be continued engagement through a quit line or other evidence-based resources. There's been a lot of momentum lately with web-based platforms and apps, and I think it's important that we're innovative, mindful that we have a strong foundation of what works, but also continue to push the needle forward, particularly as the tobacco product landscape and the demographic landscape of users evolves.
Well, we're very big on digital quitting tools here at Truth Initiative, so we can talk a lot about that and ways to help with our X program and others. And I would say to, our young people, I think it's going to be very, very important because you're the voices on the ground with social media, talking to your communities to make sure that, for instance, one of the things that, we said, and I know you talk about a lot, is that, the menthol rule is about prohibiting the sale of menthol cigarettes, not policing people who might use a menthol cigarette. And I think, the opportunity to amplify your voices to make that clear is really important. So we're talking about one flavor, menthol. I want to talk about maybe flavors more generally. We thought it was interesting, in the proposed rule even, there was a statement made about the connection between menthol and nicotine generally, not just specifically in cigarettes, and how FDA may now be thinking about the larger issue of menthol flavors in all tobacco products, particularly in e-cigarettes, and of course, the conversation about flavors in general, and any plans you may have or how you're thinking about the larger flavor issue, certainly the flavor issue. As it extends to not only e-cigarettes, but all of the other innovative products that are coming out. Mm-hmm.
Yeah, so certainly the topic du jour and a lot of very passionate viewpoints on either end of the debate on this. And for me, it ultimately comes down to the science. And following the evidence, we certainly know that flavored use is very prominent among kids, irrespective of the tobacco product. We know that it's among the primary reasons they report using the products. And most youth who start using tobacco products start with a flavored variety. When it comes to FDA's purview, we have to make application-specific decisions. And as part of that, we have a public health standard that Congress has afforded us, and we're tasked with weighing the potential benefits to adult smokers if they were to transition completely with the known risks of youth use of these products. And so we'll continue to do that for the applications that do come in. We have started issuing decisions on menthol e-cigarettes. We released the first one within the past month.
We noted.
And as I was very clear in the press release, the science was not sufficient to demonstrate that the known risks were outweighed by any potential benefits among adults. And a very important comparison, which has been outlined in guidance for several years at FDA, is the importance of making comparisons with other products. And so the flavor versus tobacco flavor is a very important comparison because it demonstrates whether those flavors are actually needed to get the intended effect, particularly around adult smokers who are using them to transition completely or to reduce the amount they smoke. And so I'm not saying that there may not be a possibility that the menthol-flavored e-cigarette could be authorized in the future. But based on the decision on this first application, the science was not sufficient. And we'll continue to use that important standard, which Congress afforded us, to make determinations. But I will say that it's a high bar in terms of youth use of these products. We know menthol e-cigarettes in particular are prominently used among kids. About a third of youth e-cigarette users report using that flavor. And so you have to have strong evidence demonstrating that potential benefit among adult smokers. And at present, in terms of the one decision we have made, that has not been the case. But we welcome strong science, and I cannot reinforce enough that the onus is on the applicant to provide the evidence to support this decision-making, and we look forward to continuing to receive applications and review that science with a very critical lens to make sure that we're adhering to that standard Congress afforded to us.
So you said something interesting that maybe I think is a distinction that could even go a little bit on the issue of the science establishing need versus preference. And I just think that's, maybe something you can talk a little bit more about.
Yeah, so there's certainly a continuum in terms of behaviors, and this has been a discussion in the field for many years, particularly around e-cigarettes. I think that it's important when we make our decisions to look at the full spectrum of the science, to be able to make that determination around appropriate for protection of public health. And it's not just, whether someone may want to try something, but what do they actually do when they do use that product? And that's where the science is not as robust. And it's important that we have a full picture in terms of the behavioral aspects of these products. And it's certainly something that is top of mind when we review the applications, to make sure that we're mindful of where the science is and, importantly, what are those behaviors. And when it comes to the net benefits, we're looking at two things. And that's one, is an adult smoker going to transition completely with that product, or are they going to significantly reduce the amount they smoke? And so it's important for us to really look at the science and make sure that that actual behavior change is happening to make that change to outweigh the known risk to kids. And so that said, I think there's a variety of different scientific data points that can be provided, but the strongest evidence is really that behavior change that's going to document either way for a marketing granting authorization or a marketing denial order around whether that public health standard has been met.
It's important, behavior. We always hold ourselves to a behavior change standard here because there are lots of things people say they're going to do, but what they actually do is often a much different story. So we talked about menthol. We talked a little bit about flavors. Of course, the other big item on the agenda is the nicotine standard, which, of course, we were very pleased to see back on the agenda. I guess that happened a little bit before you came on, but
a little bit.
But yeah. I know it's a big one on your list. Maybe you can talk a little bit more. We know it's on the list, but maybe you can talk a little bit more about where the timing in the process is, and also, in addition to the nicotine standard as it relates to combustible tobacco, which is, I know, the project that's actually on the table, how maybe you're thinking about longer term or as part of this, the whole issue of how much nicotine should be in products generally, because we've seen increasing levels of nicotine, increasing ability of devices to deliver nicotine in lots of new products that have come on the market as well. Mm-hmm.
So you are correct that we have announced that we intend to propose the nicotine product standard in classic federal bureaucracy speak. I always joke that the federal bureaucracy will always be there, like even post-apocalypse. There will be like cockroaches, Cher, and the federal bureaucracy. And so we've given a system that I am responsible for navigating us through, and I'm happy to be that Sherpa. We're not as far along as we are on the menthol and flavored cigar product standards. It's certainly a priority for us. It's in the unified agenda for the current administration, which means that it's a priority action. And I will say that for our part, we're committed to ensuring that we keep the rulemaking process moving forward as expeditiously as possible. And part of that, as you alluded to, is really collecting the science and evidence. Of course, we wouldn't announce that we intend to propose anything unless we have strong science to support it, so we have enough to act. But as part of that rulemaking process, we do solicit comment and feedback where we do ask for additional science. And so we have proposed for cigarettes and other combusted products, but as part of the rulemaking, it's not off the table to inquire about, is there other evidence around whether this should be expanded to other products, either for or against. And again, it's going to be based on the data. And that's why I cannot reinforce enough the importance of people being engaged, continuing to conduct the research. A lot of the research that has really shed important light within the past decade alone around this. In the early days, when this was first proposed in the early 90s, there was concerns about, there could be overcompensation and people will just smoke more and this will perpetuate, disparities. And we've really seen that has not proven to be true based on the randomized clinical trials and the available data. And so I think it's important that we continue to move forward with the science we have, but also be mindful that we're open to other science, and that's going to be included. And so I encourage folks, if and when the opportunity arises, to make sure they submit the evidence to help support rationale either way. And for our part, FDA is committed to reviewing every single one of those comments, because that is what we are required to do, and getting as strong a proposed rule as possible.
So I would take that as a message to our research community that's watching this now that there's an opportunity to continue to provide the evidence that will support a nicotine standard. And I guess I'll go back to the question of nicotine standard in general, not just in combustible tobacco. I mean, how much are you looking at what's happening outside the United States? Because, we are sort of unique in, we have no restrictions on the amount of nicotine in products, and the growth, for instance, of youth vaping has been sort of unrestricted here because of that, especially as maybe you look at examples elsewhere in the world. Is that something that's going into your thinking? Yeah,
so we certainly consider evidence from across the world. I suppose that's probably a silver lining of dealing with something that's so prominent, globally, is that we do have a variety of countries that are broaching this issue in different ways. And particularly for the product standards, some who have already broached the issue. A good example is the menthol prohibition. Yep. It's not a direct apples to apples with Canada, since they had lower prevalence to begin with, but it's important to look at those countries and see what's happening in terms of some of the intended impacts in terms of efficacy and promoting cessation, but also unintended. I think illicit trade is a good example where there's been a lot of attention around, these policies are going to lead to a strong illicit trade, which has been an argument in tobacco control for decades that hasn't really realized. Right. Whether you're talking about taxation or even menthol, there's some good studies showing, and even in Canada, that illicit trade is minimal. So that said, I can't reinforce enough the importance of that international research, particularly for those who have implemented policies that are comparable. And I think it also extends the other way too, at subnational. And so in the United States, of course, the benefits of a republic is that you have states that are doing things on their own accord.
It's election day. We need
yes,
to
it is. Go out and vote,
that.
folks. Yes. And I always find myself in D.C. on election day. I figure this is like the fourth time. So, yes, I pick it good. But I think that the state and local experience is really an important one as well. And that's how tobacco control has really galvanized and functioned for decades, where you function from the ground up, where you have locally salient policies that have been implemented. There have been evaluations and documenting the efficacy. But it's not a necessary approach. I would say that we also have to be innovative at the national level as well. But that important evidence base, particularly around flavor policies, are a very important way to document the effectiveness of a scale-up option at the national level.
Well, hoping for news about flavors today. In fact, we mentioned it was election day. I'll leave it there.
No.
So PMTA reviews. And I know we beat you guys up all the time on that. So won't do too much more of that today. But there is a bit of a discrepancy, right? I know that, you have reviewed 90 some odd % of the applications. But of course, the products that make up a great deal of the market either remain unreviewed or on hold, for instance, because of the Juul situation. Can you just provide us a little update on how you see the process going forward? Sort of how we maybe help you and FDA on, what some of us maybe uncharitably have said, a little bit more of a post-market review than a pre-market review, and, how we sort of get ourselves out of that quagmire.
Yes, you're so diplomatic.
You're our guest here today, Brian.
I adore it. Yes. So I will say that, of course, I wasn't born yesterday, and there's just a lot of heat, and I have very thick skin. I don't lose a beat over this. And so regardless of what the Twitterati may be, saying in their 280 character limit, our rant, it's important for us to consider the sheer volume of what we're dealing with. And when it comes to the application reviews, we got 6.7 million applications. And we've gone through 99%, which I think is a very important milestone. And the staff at the Center for Tobacco Products, again, are working day in, day out to get through them. And it's a priority of mine to get through that 1%. We're on target to do so by next year. And we've also, on top of that, have another million from the synthetic authorities that were afforded to us earlier this year. And even then, I don't think people estimated the sheer volume that was going to come in. And one of my first tasks when I took this job, after I came over across the pond on a red eye and also had COVID on my first day at FDA, was how are we going to get through all of these applications? And I calculated it out, and it was 17,000 synthetic applications a day. So Herculean at best, impossible at worst. So when you're tasked with these things, what do you have to do? You have to prioritize. And so that's what we've done in terms of prioritizing those products that are going to have the greatest public health impact, particularly around youth initiation and use. And so we've prioritized those reviews. We've already taken some actions on the synthetic front. And we also have reassigned staff on that front to make sure we were able to get through. We're now 95% through the synthetic, the initial acceptance phase, but have also begun to issue enforcement and compliance actions. So, I will say that it's a priority of mine. We've definitely got staff working, burning the midnight oil, but it's a large volume, and I can't reinforce enough that we have to do it right. And the reason is if you don't do it right and objectively, you introduce the potential for error, which will also implement risks on the back end. And we've been winning a lot of court cases lately, and the saving grace has been strong science and a very thorough objective approach. And so I do not want to jeopardize that, and it's not going to happen under my watch. And so we're putting the pedal to the metal. We're getting through those applications, and I know a lot of folks are focusing on the 1%, which personally, I don't focus on 1% in a lot of aspects of life. But I will say that it's a priority of mine in this case, and we're going to get through them as quick as possible, but it won't come at the expense of the quality in the long term. But we're getting there. We're making good progress, and I'm very hopeful in the coming months.
And we agree. The quality is important because you want it to hold when you make the authorization. And I guess this goes to the sort of the compliance and enforcement issue as well, that we've noted, for example, in our research, it's a pretty hard job in the sense that there are so many new products coming on the market every day. In fact, this is one of the things we know is that there are so many new SKUs coming on the market that the Nielsen scanning data can't even keep track of it. And so that presents a tremendous challenge for compliance and enforcement. It's sort of a, catch us if you can from the industry. But I think that's, sort of where the frustration and maybe the question for how we all work together in terms of it seems like it's an endless conveyor belt. Mm-hmm. And that, getting back to this issue of pre-market versus post-market, that people are gaming the system, literally. And, how we get ahead of that, or how do we change the narrative there?
Yeah, so I certainly understand the concern, and I will say that I'm hopeful after we get through these initial boluses that we will get to a point where the volume is not just reactive, but more proactive. And we've also shifted posture recently in terms of enforcement and compliance. As folks I'm sure are aware, we have a large toolbox of actions that we can take when those manufacturers or retailers are violative of the law. One of the first lines of defense is a warning letter. And I know a lot of people say, oh, a warning letter, you send them a piece of paper. We actually found these to be quite effective. They have an immediate effect on the entity themselves. A good example is recently we issued the first warning letter for nicotine gummies. And within a few hours of the issuance of that warning letter, the product was off of the web. And so people do adhere to the warning letters. That said, not everyone does. And in that case, I think it's very important that we crank up the heat. And so for the first time within the past month, FDA did issue its first injunctions against 6 manufacturers who failed to comply with the law. They flagrantly flouted the law after multiple opportunities to adhere. And I think that this is an important shot across the bow for folks to understand that we are going to hold people accountable for the law. It is not an assault on small business. It is ensuring people are complying with the law. An important caveat is that FDA does not have independent litigation authority. So we work with the Department of Justice. I know there's been a lot of hubbub of FDA enlisting the Department of Justice in our work, which doesn't really make sense to me because we're the federal government, so there are lawyers. You know, who else would you like us to do at the National Zoo? That's our option. And so we work very closely with them from beginning to end. And we have to make sure that the approaches we use are legally defensible. So the FDA is not the only cook in that kitchen, and we have to make sure that we are talking with our lawyers to inform strategies that are going to have the greatest impact, but also be legally defensible. And so that's an ongoing dialogue, but I can assure folks that I am fully prepared and equipped to use all the tools in our toolkit to make sure that we are enforcing the law, and that includes the recent escalation actions, including around injunctions.
Right, including brands that say they're specifically reformulating their products so that FDA can't regulate them, which is pretty gutsy.
Duly noted.
So let's shift a little bit to public education because that's a big part of what is under your remit too, and it's something we care a lot about. At Truth Initiative, of course, the Truth Campaign, we've always tried to be complementary and work together with FDA on campaigns like Real Cost, et cetera. What can you tell us about what we can expect from the public education side? Do you have any new things coming? Where are you going to focus in the coming year or so?
Yeah, so I'm really excited about public health education. It's been my jam for many years. Folks know that at CDC, I was closely involved with the Tips from Former Smokers campaign, which has really served an instrumental role in addressing adult smoking and promoting cessation. But at FDA, our bread and butter has been addressing the youth issue in a very meaningful and effective way. We started with the Real Cost campaign that has evolved over the years to address a variety of products, and the evaluation data showed that it is effective. And it's a similar in terms of the findings that we see with the Truth Initiative's work. We know that these approaches are effective at not only prevention, but also helping kids quit as well, and having meaningful dialogue around the issue. And so towards that end, public health education will remain a key pillar of the portfolio of the Center for Tobacco Products. But I do think it's important that we continue to explore new messages, new strategies, new platforms. We have to evolve with the times, particularly when it comes to kids, which Truth is so adept at in terms of making sure we have our pulse on key messages and avenues to reach the target population. For our part, this summer, we did release the Next Legends campaign, which was focused on American Indian, Alaska Native youth. It was all digital, focused on e-cigarettes specifically. And I think it's just a real good example of our continued ramping up our portfolio around health equity. We've always had great work in this area, but it's going to continue forward, and I hope to see that continue. In terms of next steps, we do have new ads for real cost coming out. I'm hopeful in early 2023. They're on the docket. I've seen them and I'm excited. And we certainly have other opportunities moving forward. I will say that I get a lot of flack around the issue of the continuum of risk and messaging around adult smokers. And my message there is the same one for the youth, is that we have to use the science to inform the messaging and the decision making. And whenever we do a campaign, whether it be the real cost or any other broad scale campaign, we have to do formative work to, one, make sure that we're hitting the right target audience with the right message that's going to yield impact, but also that we're avoiding unintended consequences, including potentially reaching populations that we don't want that could have an adverse effect. And so for me, I'm certainly open to the potential of messaging on continuum of risk, but the key is to make sure that we have science to demonstrate that it will reach that target audience of adult smokers, promoting complete cessation or a significant reduction, and that it doesn't come at the expense of youth initiation, which we know is a very problematic aspect of the current environment in the U.S. So I do think comms can take on a variety of approaches, but we also have to focus the energies where we're going to have the greatest impact. And when we've got 2.5 million kids using e-cigarettes, we've got more work to do on that front.
Yep. And, I would just, we have been focusing a lot, and I'm curious your perspective on it, on, not just the physical risks and understanding, how the industry is marketing to young people, but also with young people now in a mental health crisis in our country, that there are mental health risks as well. And I'm curious if that's factoring into any of your thinking.
Yeah, I certainly think that we're mindful of the data and continue to look at the breadth of information out there. And I think one thing for folks to remember is that e-cigarettes are still a relatively new product class. It's not the same as, cigarettes that have been around for decades and decades. We've only seen prominent use within the past decade or so. And so we don't really know long-term health effects, and we also don't know specifically around longer-term clinical effects. And so I think that there's, no question that e-cigarettes as a general product class have lower risk than a combustible cigarette. Right. We can all agree on that. But, and in other news, the earth is round and Elvis is deceased. But we got to take it to the next level. And that's, what is the effect of these products in terms of hard cessation outcomes, significant reduction in smoking, and I think also on clinical outcomes. And that's where we're starting to build data. But ultimately, I do hope that everyone can agree that kids should not be using these products at all, like any form of tobacco product. And that's something that we still have a lot of opportunity on. And I frequently get pressed as, what's the number? What's the number of kids that you're willing, to stop the crusade? And my response to that is, anything we can do to continue to reduce use among youth is a good thing. And I'm committed to making that happen with the full arsenal of resources that FDA has.
Well, we agree on that. I have one last question before we go to the Q&A. You were talking about the continuum risk, and I'm sort of wondering, and you've said, FDA's job is reducing the harms of tobacco. Can you talk a little bit about, where harm reduction as a strategy, fits within FDA's work, and even perhaps how that fits as a tool in, what's increasingly being talked about in the public health tobacco space about, endgame strategies, the elimination of the harms and influence of tobacco, and sort of how you see those things intersecting.
Yeah, certainly. I think the biggest point for me is that these things don't necessarily have to be mutually exclusive from one another. And, I was in the tobacco control field before e-cigarettes hit the market. I'm in the throngs of it now. And I remember a time when there was civilized discourse around the facts and evidence. And I think now we've got such polarized extremes that we've lost that ability. And it's time to extricate ourselves and start trying trying to find middle ground. And I think that the youth use issue is a very important one, and something that we definitely have the tools to broach in a meaningful way. We know we can go lower in terms of prevalence. We've been there. We certainly have the opportunities to do so. But that's not to say that that's the only avenue that we can broach. And I think that there's certainly opportunity for us to acknowledge that a continuum of risk exists and that the benefit there would be for adult smokers. But we have to make sure that we continue to pursue that in a way that's going to be based on science and also doesn't have those inadvertent effects on kids. And for me, it's important that we look at those longer-term terminal outcomes. We're beyond just saying, oh, well, it's lower risk. Cigarettes have 7,000 chemicals and 70 carcinogens. Most things are safer than that. But the big questions scientifically are, okay, lower risk, we know that, but are people going to transition fully? And that's where you're going to get that net benefit, especially if it happens at a rate that's going to outweigh the known risks among kids. And so for me, I really encourage folks to not do an either or. We can do both of these together, and I would hope that any reasonable person would agree that kids should not be using these products and that we still have opportunity on that front. And so for my part, I'm committed to continuing engaging on that front. And again, the science is going to guide it, and I welcome the opportunity. I've met with many people, including those who have quit smoking using e-cigarettes, folks who are doing research on harm reduction, and I welcome that dialogue, but I just want us to be mindful and diplomatic in a way that's more productive than where we're at. I think at present it's like trying to convince a rock to fly. It's not going to happen. It's futile, and we've got to get back to the bread and butter strategies. That said, I think that there's definitely a lot of opportunity for continued engagement around this, including in a lot of the actions that FDA has in the queue. Talk about risk reduction. The nicotine product standard is a really prime example of harm reduction. Talk about a very quick win based on the randomized clinical trials of the effect that we would get from reducing the nicotine content in cigarettes and other combustibles. So I think it's certainly a topic that's front and center, but I really encourage the broader community to be mindful and have constructive dialogue in a way that's not going to diminish the prominent and known concerns among youth, but also being mindful that we have to follow the science here.
Well, we have our first question.
Wonderful.
All right. Do we have the affiliation from the person who asked this question? No, we don't? Okay, well, I guess we'll ask it anyway.
I'm sure they're a wonderful person.
What are the major challenges the Center for Tobacco Products is anticipating in the coming years?
Major channel. Many. Added to the laundry list. A CVS receipt, if you will, nice and long. I will say our biggest challenge is really just the volume of what we've been tasked with versus the resources and time. And this is always going to be a struggle. In terms of our resources, we've been flatlined for many years. We get our funding from user fees, and we have not seen a change in those. And on top of that, we're getting more things that people want done. And they continue to pile on with the year. And it's a lot of work. And I can assure you the staff are working 24/7 in many cases to get us to that endpoint. But it's going to continue to be a struggle. And as I noted before, any good leader, when you're faced with this, you have to prioritize. Because what we can't do is, put a choke chain around staff and get them to the point where they're no longer able to function and there's no well-being or health. We have to be mindful of what's most important, what's going to have the greatest impact, and be strategic about how we expend those resources. And so for my part, I'm committed to making that happen at CTP. But I do think our greatest challenge is really going to be making sure that we do allocate those resources we do have in a way that's going to have the greatest public health impact, and also being mindful that we're always going to have new things thrown at us. And that's just the nature of the tobacco control landscape. We've got products coming, new every couple of months. There's always going to be innovation and change, but sometimes that's a good thing. Innovation isn't bad, but we have to make sure that we keep a pulse on that in a way that's going to be effective in terms of regulation of these products. And so I'm hopeful in the months and years to come. I know folks have inquired about how long I'm going to last in this position. I anticipate it to be very long. We should do it before and after. I'll probably
like those presidential photos.
Yes, but I'll look like the creature from Tales from the Crypt, probably the crypt keeper by one time I'm done. But I think that I'm certainly committed, and I'm a longtime civil servant. This is not my first time at the rodeo, and I've worked across multiple administrations, and I'm hopeful that we're going to get a lot of really important, impactful work done in the coming months and years.
Well, we certainly hope we have you for a long time. We have another question. Nearly 3 million of our youth in the U.S. are addicted to nicotine because of being targeted with flavor vapes, yet there are no dedicated centers to help them quit. Is there a plan in place nationwide for such programs dedicated specifically to youth that have been targeted and are still being targeted? And I'll just say before you answer, This Is Quitting from Truth Initiative is out there for 3 years now. 500,000 young people have enrolled, but we need even more.
Checks in the mail, whoever asked that, from Robin Koval. No, I think it's a great point, and I think something where talk about research and innovation opportunities. We have a strong basis of what we know works from the adult science, right? We know we have medication and behavioral counseling, and now we've had critical innovations around the behavioral counseling of app-based systems and web-based approaches, and in ways that we can really leverage the way people communicate to reach them in impactful ways. That said, I think that there's an area where we're really under-researched in terms of the breadth of comprehensive opportunities when it comes to kids. And I think for the longest time, we didn't really have these discussions because prevention was such the focus. Right. And we didn't have so many kids using the products, particularly with very high nicotine yields, that they were highly dependent and addicted. And so I think we're at the precipice of a really important period where we have to have those tough discussions. And of course, an ounce of prevention is worth a pound of cure. It still holds. We need the population-based approach to prevent it from starting in the first place. It's a hell of a lot cheaper to prevent it from starting than cleaning it up on the back end. But we have to have resources to help kids quit. And towards that end, for FDA's part, the other side of the House, Center for Drug Evaluation and Research, is tasked with drug reviews, and that would include cessation therapies. And so we certainly work with CEDAR in terms of exploring opportunities to build the science there and encourage entities to submit applications to get FDA-approved mechanisms. But in the meantime, before you get to an FDA-approved mechanisms, you need the science to demonstrate it. And that's where I think key evaluations are important around innovative strategies. And as those continue to be developed and implemented, getting that strong data that's going to help us update clinical practice guidelines, get best practices, and really get that evidence where we can scale up in a meaningful way. But in the interim, we do know that behavioral counseling in particular and education are really strong levers based on other tobacco products and are going to be a key approach when it comes to kids. In addition to those population-based strategies, they're going to create an environment where these products are less accessible, acceptable, and desirable.
Well, we've even talked about, even just normalizing the idea of quitting. Mm-hmm. For young people, because of course, and I think we know this from cigarettes too, there's the perception that more people are using than actually are, and in your friend group that might be true. And so, while we denormalize vaping and do the prevention side, it is important to normalize the idea of quitting. Absolutely. That it's possible, you can do it, there are ways to do it, and making young people feel okay about it.
Absolutely.
Last question. How would you go about teaching young children the harms of electronic cigarettes? And what can youth do to participate? Oh, I like that. What can youth do to participate in the work of CTP?
Yeah, so I think in terms of how to go about teaching kids, I think you've got to relay a message that they're going to understand. And there's been a lot of really good formative work on this, particularly by CTP and Truth Initiative and others in terms of what are the factors that drive kids to affect change. And they're not thinking about decades down the road. They're thinking about acute effects. What are the immediate? And we do know that these emotionally evocative, really hard-hitting campaigns that speak about risk can be very effective. And that's where real cost has focused his energies. We know these products contain nicotine, which is highly addictive. It can harm the developing adolescent brain and also prime the brain for addiction to other drugs. But there's also other potential ingredients that are harmful or potentially harmful. And so I think it's important to have those conversations with kids around what the risks of these products are, and also the avenues in which these products have been promoted and made enticing for them, particularly the role of flavors. And that's important dialogue towards prevention. And I think it's also youth influencers as well. We focus very prominently in terms of kids, which is an important lever, but there's also others that have key touch points. And I think we can do a better job of engaging with folks that are those gatekeepers, are key conduits of information that can reach them in a very impactful way. In terms of participation, I think the biggest is get the message out. We have a lot of great resources from the Real Cost campaign in terms of education resources and materials to really galvanize youth, educate them, and get the discussion going, as you mentioned earlier. And so for that, towards that end, it's very helpful that the CTP resources are leveraged and that we also get information about things that are happening. It's not uncommon for me any given week to get an email from someone with, oh, I saw this product, or I heard this, or this is popular in my school. And keeping that pulse on what's happening at the local and state level is very important to us, and how we've identified very prominent issues very early on by getting that real boots on the ground, grassroots information around what's happening so that we can start to look at it in a scientific way to help implement strategies to mitigate it.
So if a young person sees something and they want to let FDA know about it, what should they do?
They can report to the Safety Reporting Portal. Is the best way. If you go safetyreporting.hhs.gov, and you can report anything about tobacco products, or you can send it to the Center for Tobacco Products at FDA. Go on our website, and we have emails there. But we don't know unless you've submitted and told us. So I encourage you to keep engaged. And we're also on all the social medias. I don't personally respond. Some people think I'm actually on Twitter, but no. I joke I use my opposable thumbs for more productive means. But we do value the dialogue and look forward to getting any information we can to help us do our job better and help protect Americans from the known preventable risks associated with tobacco use.
Well, great. I think that is all the time. I'm sorry, I'm sure there are more, but we couldn't get to everyone's questions. But I just want to thank you, Brian, for being here with us today and taking the time. I know how busy you are. And thank you for this discussion. It was really, as always, illuminating and informative. So thank you for that. And thank you to our audience, for everybody that's here in person and everybody that's with us online. I encourage everybody to visit us on truthinitiative.org, and we'll also have a recording of this session there as well, so you'll be able to view that and share it with others. And I just want to give you a round of applause and thank you for being here.
It's a pleasure to be here.
Thank you.